So this is an image that shows us essentially what happens when we have a herniated disc. And this can look a little bit alarming, but hopefully the more I describe what's happening here and also highlight the research that's been done, you'll realize that often this isn't such a worrying thing. So we have the annulus fibrosus here, the outer casing, and then we have the kind of softer nucleus pulposus. And what has happened is that it has begun to bulge. So it moves into an area that it's not meant to be in. And in this case, but not in every case, what has happened as a result of this is that one of the nerves exiting has been pressed on by this bulge or herniation. And thankfully, this isn't always the case. So I hope that kind of visual aid gives you an idea of what's happening. And once again, remember there's this huge ligament here at the front, a huge ligament at the back. And this is why the bulge often doesn't happen in those directions, but kind of sneaks out the side here to move out of the way of the ligaments that are there to help and support this region. And while we're looking at this diagram, I want to talk a little bit about the latest research that's been done. And a really amazing study looked at the prevalence of degenerative or age-related changes like this in discs in a large group of people that were not experiencing back pain. And what that study told us is that the prevalence of herniation simply increases with age. And again, for most people, it's not related to back pain. So this tells us that this process could simply be a part of the natural aging process. There was actually a large literature review that looked at a group of 20-year-olds who were not experiencing back pain, and 30% of them had intervertebral discs that were bulging but were not experiencing any symptoms. A second review showed that in a scan of 50-year-olds who were, again, not experiencing back pain, 60% of these people had bulging discs, and actually 80% had what is called disc degeneration. I find degeneration to be a very fear-based word, so I much rather use age-related. In one study, 50% of patients were noticed to have had spontaneous resolution of a herniated disc with conservative treatment, and that means without surgery. So this is a mystery. We don't actually know why the discs behave in this way, but we do know that up to half of cases can spontaneously repair themselves. And what was fascinating is that the authors of that study also noted that the more severe the herniation, the greater chance of spontaneous resolution. And I actually wrote that recently in an article, and someone edited it for me and said, "Oh, you've made a mistake." And I was like, "No, actually, it's not a mistake. This is actually what's happening." So we'll look at this topic a little bit later when it comes to supporting injured students. But actually, if a student does come to you with a herniation, it's really important to ask them how they're doing. Like, are they experiencing pain or dysfunction as a result? And the likelihood is that they're actually not in that moment. The problem is that we nowadays get scanned very often, and we end up having all this information about our bodies that really we probably either shouldn't know, or if we're being told, it should be told in a way that is actually very accurate. So if you go for a scan, you might well have a prolapsed disc, but that could be appropriate for someone in your age category. And often that is not the way that information is shared to us, unfortunately.